Hi, my name is Dr. Matt Khurana. I'm going to talk a little bit about hip pain and hip injuries and hip pathologies. A lot of times we'll see people with hip pain in the chiropractic office. What I'm going to talk about today is more importantly the hip joint. Sometimes people will call the ilium or the low back and the pelvis their hip pain. I'm paying particular attention right here to the pain you have right here with hip pain. A lot of times with older patients, we'll see a lot of hip kind of trauma and injuries. There are a lot of different ways to diagnose and to treat these conditions. Mainly a history and exam is very important with hip conditions. A lot of times we'll need to do x-rays and or other imaging to definitively find out what's going on with the hip. We want to rule out fracture and any other pathology and or arthritis in the hip. Once we have that information, there are a lot of things that chiropractors can do to help a hip pain resolve and help it improve. Basically, I break it down into two types of care. There's passive care and active care. Active care is the different exercises and stretches and things that we'll teach you to do at home. And they can be important, but initially passive care is going to be the care that's going to be really helpful to get the hips to resolve. The adjustments of the hips, we have adjustments we do particularly just to the hip and or the low back and the pelvis. Sometimes we'll even adjust the knees and the ankles to make sure everything's tracking well with the gait. And so the passive cares also include things like therapies, laser, ultrasound, those things to reduce the swelling in the hip area. We pay particular attention also to the muscles, the quadriceps and the hamstrings and the gluteus muscles to make sure that they're balancing. And so we'll do things to stretch them and to strengthen them to keep the pelvis balanced. And that again will resolve the hip pain. Chiropractors do a great job with hip pain.